Actually, let me go ahead and move this out of the way. 1 second, guys, so I can at least see my face here. Let me see where I'm at. There I am. Hello, everyone. But we're talking about a very important vitamin. I just want to review to our new listeners right now coming through. We're targeting overseas right now. I want to say hello and welcome to everyone out there. Today's topic is a specific type of vitamin that is going to make a tremendous change, potentially reversing osteoporosis, increasing the strength of our bones, and helping your heart. Now, wouldn't you be happy if I tell you that you can prevent a lot of heart disease and calcification, atherosclerosis, arteriosclerosis, kidney stones, because many people out there who are taking calcium may not be taking correctly. So I'm going to teach you something that's very powerful. I'm going to teach you something that the Japanese people out there have very healthy hearts, a very strong immune system with a good cardiovascular system because of the way they eat. And I'm going to explain this very thoroughly to you, and I hope that you will enjoy. Let me just go ahead and put one little thing here. Let's see if I can find this. 1 second. Okay, so before we go into anything, I want to touch on a little bit where I was the other night about vitamin D and how important vitamin D is, because without vitamin D, calcium does not absorb into the bones. You can be taking calcium, not getting enough vitamin D. Most people do not get enough sunshine because we're not kids anymore. We don't play out in the streets like we used to. We get up, we go to work, we're in our car, we're at a bus, we're underneath a covering all day long, and we're not getting sunshine. Without sunshine, our body does not manufacture vitamin D, and very few of us are getting enough of it. So therefore, deficient vitamin D causes the calcium that we're getting from foods or from vitamins not getting to where it needs to go. But the problem here is that we left out part of the equation that we're going to touch on tonight, because this particular nutrient is going to help get the vitamin, that calcium, to where it needs to go. We don't want it to go to the heart. Don't want it to go kidney stones to the kidney. We don't want it to go into the vessels to call arteriosclerosis. We want to get into the bones and into the teeth and where they need to go. Okay, so let's talk a little bit about vitamin D. We know that the main areas we get vitamin D from are fish, cheese, butter, margarine, fortified milk, and fortified cereals. Obviously, the other way of conversion of getting vitamin D is through the sun, which again, very few of us get this. Now, it's very important. Now, without vitamin D, we're really in trouble. Vitamin D is so important. The majority of the population, they say 70 to 75% of the world is deficient in vitamin D. And I believe that. Vitamin D here does amazing things. We talked about last night about people who have chronic muscle aching. Now, a lot of people out there, my listeners, subscribers, as well as people tuning in quite often, have pain. There's a lot of self-help videos. We've done hundreds here on YouTube. If you're new to this program, you should check them out. Check out my channel. But muscle aching is such a big thing with vitamin D. Weakness in your immune system, extremely big. People who has a weakness of the immune system of getting colds often, strep throat, ear infections, run down, even blood pressure, and many other diseases. We talk about, and I'll show you other foods that have a lot of vitamin D in it in just a while, but vitamin D plays a tremendous role when it comes down to bone strengthening. And again, if you're in the sun, you have to get it on the large areas of your body, just not the small areas, not the hands, not the feet, the large areas of the body for a good 15 to 20 minutes. Very, very important. Vitamin D. Now, we look at this right here in osteoporosis. This is a big topic. We're talking about healthy bones, guys. Healthy bones is going to keep you nice and strong. Sakura, how are you doing, my friend? We missed you last time. Healthy bones, compression fracture, lack of vitamin D. As you get compression fractures, quite common. As the bodies of the vertebrae start to compress, eventually they start to go forward. We start to hunch over. As we hunch over, we start affecting nerves, start having lots of pain. Our posture is deformed. Very important. We never want to get that way. We want to do all in all to keep ourselves very, very strong. We look at skeletons. This is like part of our little thumbnail. I love this picture here, but we want strong bones. And not only do we want strong bones, guys, we want a strong heart. Because if our heart is strong, we're going to be blessed. We're going to live a strong life. We're going to live a healthy life. And we're going to live a happy life. The purpose of us being together is education. Is taking the education in and going about it the right way, because if you follow just what your doctors say, guys, you're not going to cut it. We got to be proactive. We got to do our homework. We got to do our research, and we got to take care of ourselves, because today throughout the world, medicine is not about prevention. Maybe in certain areas, certain countries, maybe more like China with acupuncture. Okay, maybe in India, maybe with yoga and stuff like that. Namaste. I have a lot of India patients, people from India who tune in with us quite often. But we really need to be proactive. So when we look at what we're talking about today, the devastating effects of low vitamin K, let's just talk a little bit about vitamin K. There are two kinds of vitamin K. The first kind, basically, I don't want to go to this yet. The first one basically is your vitamin K1. Your vitamin K1, and let's go to this right now so I can go ahead and explain it to you so we don't really miss anything out. Your vitamin K1 are primarily your greens. And your vitamin K1 basically are your kales, your spinach, your Swiss chard. And we need vitamin K1 because primarily K1 is designed for clotting. So people who are on Coumadin, who are on blood thinners, obviously the doctors tell you, or better yet, when you're about to get surgery, they say no greens, no spinach, because we don't want all this K1 in our system. It can cause complications, all right? Particularly if people are on Coumadin, they don't want you eating certain greens. But all in all, I just want to give you a little bit. It's called Phyllo Quinone, which is basically the leafy green vegetables. Now, that's basically for clotting. We get that. So I'm not really concerned about our K1s for today's program. What I'm concerned about today are our K2s. All right? Our K2s. Now, the K2s, this is why the Japanese are so healthy. All right? Now, if you understand about K2 primarily are the organ meats, the egg yolks, the dairy products, the soft cheeses, the nattos, the fermented foods. You notice in Japanese, the fermented foods. If I got a lot of health food nuts out there about fermentation, you know about fermentation. It's very healthy for you. You're getting the K2s, and the K2s are extremely important because the K2s is what brings calcium to the bone. This is where we want calcium. So, and I'm going to show you something, because what the manufacturers are doing is that they're putting vitamin D with the K2s because they're realizing that the vitamin D needs to be with K2 to tell the calcium to get to the bone. Without K2 or without enough K2, the calcium's going to the vessels. So we can prevent heart disease. We can prevent a lot of this. We can reverse osteoporosis. There are plenty of studies out there that people who are assimilating with K2 are reversing osteoporosis. Their bones are getting stronger. But doctors aren't going to tell you that because they're not inclined to nutrition. Guys, I'm going to tell you something. Nutrition, man, is where it's at. We are who we are. We are what we eat. Don't be fooled by that. Those medicines and those drugs are just going to be putting a burden upon your organs. There's a lot of research here, and I don't really have the time to go into it today, but I'm going to show you a couple of the things. When we look at the fermented soybeans and we look at the natto, the dishes that they have in Japan, this is primarily all where it's coming out of Japan, their K2s are so high in their Japanese dishes that they experience very little osteoporosis. Think about that. They have strong bones because this is the reason why. And I'm going to show you a little bit. I'm going to give you nutrients and show you the difference about how much you should be taking, and I'll tell you a little more about vitamin D. We'll go into that. But there are so many studies here. It's exciting. I mean, I'm looking at these studies. It's crazy. even people who had reduced bone fractures. Their bones are stronger. The bones are more dense. They look at people who fall. Here in America, you fall and people are fracturing their hip. Boom, they're fracturing their hip. And 25% are dying from this because of complications. But in Japan, you don't see a lot of fractured hips. You don't see a lot of fractured bones because of this K2. So K2, it likes to go along with vitamin D. And between the two of them, they direct calcium to go right to the bone, like 95% of it, and it doesn't allow it to go to the kidney stones. So if you're prone to kidney stones, guys, this can be a miracle worker for you, because taking K2, your kidney stones can go away. People don't know that. Urologists don't even know that. But I'm telling you, it's true. So let me just see if there's anything else I wanted to mention to you about this. We know that, let's see here, we know that calcium preventing heart disease, obviously in other countries who are low in K2, there's much more heart disease. In America, guys, we have so much heart disease here, it's crazy. Our diets are shitty, excuse my language. They're so bad, and we're deficient in this. This is so important. Okay, so let's go to a little bit, we're looking at the K2 there. I want to go back just for a second here. Actually, let's look at this right here. This is calcification in an artery. We all heard of arteriosclerosis, atherosclerosis, hardening the arteries, plaquing in the arteries. This is K2 will prevent a lot of this. I'm telling you, this is really good stuff. And when you're done with me, go to Google and start playing with K2s. Google it, and you're going to be amazed how much you're going to learn. You can share this with your parents who are more elderly. They're going to appreciate this. This is going to do a lot of good for them. We look at this, okay, we're not going to forget that today, okay. Sala, you're talking about you were diagnosed with vitamin D3 deficiency. Most people have vitamin D deficiency. You're about 25, and that's kind of borderline. I was low there too. You were D3 with K2 5,000 for 6 months. Good. And we're talking about D3. I'm going to go into that in just a second. Let me just come down to right here, the vitamin D. One of the best thing, we look at vitamin D here. The best ones are your fatty, your fatty, your dairies, your livers, your fatty fishes, your salmon, your mackerels, your sardines. And again, you have other foods that are fortified with vitamin D. But vitamin D is so important, guys. We don't get the sunlight, so we are deficient. Trust me. Here you're looking at someone right here. People look at me and they say, "Man, you look healthy and everything else." But I was deficient in D3. I was deficient in vitamin D. I couldn't believe it. If I'm deficient, I can tell you that millions of people are deficient, because I eat very well. I eat lots of greens. And I have a background. I have a doctorate in nutrition. I know lots about nutrition, but just because we're deficient, many of us don't know it because we're not checked for it. So I want to go to a very important study here, guys, and I'm going to move forward. We're getting there. This is a very important study called the Rotterdam study. This study, now you guys, I want to let you know that this is going to be posted on my channel, so you're going to be able to come back to this. You're going to be able to share this video. The Rotterdam study showed a 50% reduction in cardiac mortality. They've done studies, and they showed that people who are taking greater than 32 micrograms of K2 had the best outcomes. Now, generally, I'm going to tell you, when you get K2 in a formulation, they're normally about minimum 90 micrograms. They're usually about 90 to 100. Some have 150, 180. And I'm going to show you a couple supplementation vitamins, the back of them, what they look like. But the bottom line is, look at this. K2 directs calcium into bones, not into arteries. Golly, that's exciting, guys. K2 directs calcium into bones and not into arteries. K2 hardens and calcifies the bones and helps decalcify arteries. Wow. Can you imagine being diagnosed with heart disease, calcification, atherosclerosis in your arteries, and now it can be reversed? Guys, these are studies. This stuff is real. I'm telling you, this is exciting stuff. Yes, Alea, this is amazing stuff. And I'm telling you that people like you aren't going to hear about this, but that's my job, because who am I helping? I'm helping myself. I'm helping my family. I'm helping my friends. I'm helping my patients. And guys, I really, truly want to help you too. So I really want you to take this serious, because you can really live a lot longer and be a lot happier. That's really powerful stuff. And these are studies, guys. You can look at these studies. This is not me telling you this. I go for the rooted kind of stuff, because I'm that kind of study guy. So let's look a little bit about some labels here. If you look here, menaquinone is obviously, if you look, there's vitamin K, 150 micrograms. That's a little high, obviously. It's not going to hurt you at all. But if you look at these labels here, here's another one here, vitamin K, 100 micrograms of menaquinone. That is the natto. They call it menaquinone 7 from natto, or NATO, whatever you want to call it. Here's another one here. Actually, that's not one right there. Here's one here. Basically, here's another one showing 100 micrograms. And they generally come with that, but a lot of them now are coming with vitamin D. And vitamin D, generally about, where were we at when last time I saw it? There were about 1,000 IUs of vitamin D, international units. I take 5,000 a day, guys. And I was telling people last night in our last program, I take 5,000 a day, and I just recently had my vitamin D checked, and I'm not over high. I'm still in the middle, but I'm normal, okay? So just because you're taking it, you're not going to toxify from it, but you know what? It's going to help your immune system. I think the last time I had a cold was maybe 2 years ago, and it lasted maybe 2 days, okay? Because vitamin D increases your immune system. Vitamin D is healthy for you. I'm telling you guys, vitamin D is amazing. Go look at the benefits of vitamin D. And it's just not about bones. It's your immune system. It keeps you nice and strong. Now, as you talk about vitamin K, K2 supports healthy bones and promotes vascular health, and does a lot more, by the way, guys. It does a lot more than that. But I just want to give you the highlights. We talked about, let me see if I can come back here. 1 second. We're finishing up. We talked about here osteoporosis. Osteoporosis, lack of calcium into the bone. The internal trabeculae of the bone is not solidified. You see that one above the high normal vertebrae, osteoporotic, and one below is a compression fracture. There's more compression fractures from lack of calcium. Now, this K2 will get calcium to where you need it, guys. Very important. Now, menopause females, your estrogen level starts to really drop and fall, and it throws down the calcium. Yeah, it's going to throw the calcium down, and it's not going to allow it to assimilate to where it needs to go, so this K2 may be a big adjunct. Hey, Janine, it's a bit late, yeah, but you know, sometimes I wake up, this is a good time. I got a lot of people out there overseas, and obviously this is morning time for them, or actually afternoon time for them, and it's nice to touch this market because I enjoy. I'm a late bloomer. If you notice all my videos that I posted over the years, you're always getting probably notifications 1, 2, 3 in the morning. So this makes it easier for me. I don't have to go ahead and edit because YouTube will put this directly right on my channel. Sir, how do you fix a wedging vertebrae, D10, D11? You're not going to fix the wedge. I will say you can sustain the strength when something wedges and it's compressed. It's usually going to stay compressed. That's a common area between the lower thoracic area, and the reason is because that's a transition area. Because if you look here, all right, we're looking down here, T11, T12 down here. This is where it meets the transition of the first lumbar. So if you're getting a wedge in here and you're getting a little bit of wedge, usually that will not bring you forward, okay, because your other muscles, the quadratus lumborum, the erector spinae, the muscles, particularly in the core down low, will keep your posture still strong. Now, when you get wedging up here from osteoporosis in the cervical thoracic junction, this is where you can't help because you don't have much muscle in here that's going to keep your head up. Once that wedges, you kind of fall forward and the shoulders round forward and you start looking for potential problems. Let me just see, guys, if there's anything else that I missed with you. Let's say we talked about the guide here. We talked about the heart health. We talked about the study, the vitamin D food guide. We mentioned that. And I think we pretty much really covered the jut of what we're talking about. I really hope, guys, that you will continue to spread these videos out. Our new listeners out here, I welcome you. If you haven't been in our programs lately, I'm enjoying doing the live videos with you guys. This just keeps me on my toes, and people like to interact. A couple quick questions. By the way, here's Devanshu. Good morning, doctor. C6, C7 minor disc bulge. Is surgery the only way? No way. I'd tell you that surgery is no way. Disc bulge, I don't think I've had a disc bulge surgery in 30 years, guys, unless it was serious compression, muscle atrophy. Guys, let me just tell you this, all right? Very important. When you have a herniated disc or a disc bulge, if there is normal motor strength, normal strength, there's no atrophy, no loss of the muscle size, and your reflexes are normal, you're not a candidate. All right? Just remember that. I don't care what you have in your disc. I don't care what your surgeon tells you. If you don't have those three, loss of reflexes, atrophy, loss of muscle, or significant muscle weakness, you are not a candidate for surgery. Unless you're losing bowels or having problems in your bowels or urinating. That's another condition. But in general, I don't recommend. DJ Cool, good job, guy. He just got some K2. Excellent. And I got a lot of people hit me after our program last night. We did it on calcium, magnesium. I'm sorry, vitamin D and calcium. There's another program. I do have a good video on magnesium. I think I will do another video live on magnesium. Natural Calm supplement powder is good stuff, Carrie. For people who have who are really wound up, who want to relax, who want to get a good night's sleep, or people who have muscle cramping, magnesium is very powerful, guys. If you feel like you're real anxious and your doctor's putting you on like Xanax or Ativan, magnesium may be the answer for you. People trying to get to bed, like valerian root, one of my favorites. Excellent herbs, a lot of good stuff. Well, let's see here. A straight neck, how do you fix it? Go back to posture. Work on your chin tucks. You can use a good cervical pillow. Don't worry so much about the curve. Worry more about sustaining good posture. I can tell you about 70% of the world has a straightening or the loss of cervical curve because we spend so much time. So you're going to be okay there. You've been using extra magnesium for several years now, Heidi. Okay, that's great. Let's see, Donna, is it true that calcium supplements need to be a mix of calcium, magnesium, and zinc? Yeah, calcium, more than zinc, calcium, magnesium is important. And generally half the amount of calcium should be the magnesium. So if you're taking 1,000 milligrams of calcium, I'm going to tell you half the amount is a general rule because magnesium is important. Also, one very important thing I'll tell you about magnesium. There's been a lot of studies out there, and I'll go into this when I go into magnesium, but I just want to throw something out at you. Those people who are taking certain medicines, particularly blood pressure medications, that will deplete your magnesium. People who are drinking lots of sodas, that can deplete your calcium and magnesium. So as you're taking these particular minerals, you could be losing a lot and not even knowing it. So I am going to recommend that when you're taking a calcium supplement, don't take a calcium carbonate. Get like the citrates, the glycinates, or find other types of supplements that are good quality and do your homework. Amazon has usually good quality. A lot of them will have a calcium potentially and a vitamin D and magnesium mixed together. All right? So all I want you to know is one thing. Remember one thing, guys, is that before you realize what you're trying to do for your bones, make sure that that calcium is getting to where it needs to go. Because if you're just taking calcium and you don't have vitamin D in your system, it's not getting to where it needs to go. Now, the other trick we learned today is K2. Now, if you're going to follow that nutrition schedule, you can come back to it where I posted it. You can do homework on it. I'm not telling you guys that you have to take a vitamin of K2. If your diet is good, then you should be fine. I just wanted to bring that out to you because many of us are very deficient because of the foods that we eat. Well, anyways, guys, one last thing. People ask me how to get a hold of me, and I get 300-400 emails a day, sometimes up to 500 emails. It's crazy, but people like you, I tell you from my heart, Facebook Motivational Doc is my fan page. And that's the easiest way, answering questions. And certain people I'll talk to. I want to do whatever I can. So, guys, I just want to send my love to all of you. I really appreciate you coming in the chat room with me. And you guys are late bloomers like me. It's a good time to be together. Hopefully you learned something. Do your homework. Share these videos. We're way over 1,000 videos. And again, lots of great self-help videos. Roshan, neural issues with anxiety. You can't sleep. Magnesium is one. And valerian root. Valerian root is excellent. Chamomile tea is good. Make it a nice relaxation, guys. Valerian root I love. And you can actually go with a little melatonin. Melatonin, 3 milligrams. I have a little melatonin spray. I'll spray it in there before I go to bed. And let me tell you, boom, knocks me out. So thank you guys very much. Ed, thanks for being here. Panata, thank you for being here. Blessings to everyone out there, and we will be in touch real soon, okay? Good night. And again, across the other side of the world, I want to say good morning now.